All right, here we are, powered by Iron Health Podcast with Dr. Jade.
Hey, what's going on, man? Everything's all good. What about you?
Good.
Yeah?
Can't complain. Jade's voice is a little under the weather if you guys hear it.
Yeah, went to a wedding this past weekend. Had a couple celebratory cigars, and not used to that, so
Yeah.
kind of messed me up a little bit. But I'll do my best I can to do it. Like I said, I was doing some vocals before all this and trying to get it warmed up, but we're
You
good.
can't even hear it. Don't worry about it.
Okay, that's good.
All right, so we've been starting these podcasts a little bit, telling our viewers a little bit about you. Of
course.
So let's go into why you became a PT. I think that's always an important story. Your origin story is always nice to hear.
Yeah, definitely good question. I think my origin story or becoming a PT is your typical kind of, PT story. I played football in high school and tried to make a tackle on this dude that was a lot bigger than me. I was also a little bit bigger too. I played a little bit linebacker, but it's a different time. But I tried to go make the tackle, and I was able to do so after he dragged me a good 3 yards. But when making that tackle, I was just grabbing onto his jersey, just trying to pull him down. Felt a little pop. And when I heard that pop, I kind of felt my shoulder kind of go in and then out, so kind of like a subluxation. And after that, I didn't feel too good. I was out for maybe a couple plays after that. And, back in the day, mindset's like, you know what, just go back in, finish up the play, finish up the game, deal with it later. And I did that, but kind of a big mistake there because throughout for the rest of the week and maybe a couple weeks after that, my shoulder just didn't feel normal, kept going in and out. And it wasn't just with playing football, it was also with putting my shirt on and stuff like that. So went to go see an orthopedist. It was pretty much just like, okay, it kind of looks like, some instability there. Might be something with your labrum. Did an MRI to confirm the labral tear. And the first thing the guy wanted to do was surgery. So when I kind of heard that, I was like, okay, understandable. But at the same time, I'm not an overhead athlete. I feel like I can get by just by doing things. Let me see a second opinion before I do something drastic, right? So I go see a second opinion, and he says, it doesn't look that bad. Kind of said what I, had in my head in the beginning was, an overhead athlete. I'm probably not going to play at the next level. I had to be real with myself, at that point in my life, right? I'm not going to play any kind of college sports right now. And I was like, you know what? This guy's right. So I went to go do PT, and of course, if that didn't work, then I would consider surgery. So I went to go do some PT, 3-4 months, so a decent amount of time. It was a labral tear, obviously, and felt better after that. Went on to play a little bit of the season, so I maybe missed like a month or so because it kind of happened early on in the season. Had no problem after that. Came back my senior year, played all, the whole season, no problem after that. The only thing I can't do right now is just, throw 100 miles an hour 1,000 times. But again, that's not really what I do.
That might not be in the cards for you anyway.
Yeah, I think it's over at age 30 now. You know what I mean?
Yeah.
So but ever since then, man, I was like, you know what? I want to make this, something that I do for the rest of my life. And ever since then, I was just in love with PT. And again, just thinking about how I was able to avoid surgery and pretty much fix myself via the help with the therapist I had, of course. And being able to do that to someone else that was in my shoes maybe when I was younger was very empowering to me. So that's something that I wanted to, kind of continue. So that's kind of became a PT, and it's very rewarding work. And although it could be brutal at times, but you see some of the success stories at the end, and I'm happy that I'm one of those, and I hope to bring that to some of the patients that I see, here at Iron Health for sure.
That's awesome.
Yeah,
that's a great story. I love hearing stories like that. What brought you to a second opinion, though? Because I know that's always an interesting thing. As me as a kid, if I got hurt, whatever the orthopedic said I would do, I was blindly. Was it your parents? Did you have some mentorship in that category? Because not everyone has that, right? Usually people abide by what the first person says to do.
Of course. Definitely parents had influence on it. Both of my parents work in healthcare. My dad's an x-ray technician, so he kind of knew what he was reading a little bit before I even went to go see the ortho. My mom's a nurse as well, too, and she's kind of just seeing how, just surgery isn't always the best route the first time. So I was kind of lucky and blessed in that way that I had parents kind of looking out for myself. And, they were also on the cusp a little bit as well, and so was I. But, seeing a second opinion just for something that I was just on the fence about, I think was kind of the best route I was taking. And like I said before, just having parents in the field, I think really helped with me making a decision going forward.
Yeah. I mean, that's an interesting thing. How do we educate more people about that? Because... Yeah. Like I said, for me, if that was me in that situation, I might have just gotten the surgery.
Just right went through, right?
Yeah,
no, I agree. I think.
How do we bring that to the public? How do we say, listen, just because your orthopedic says it and they may say it aggressively doesn't mean it might not necessarily be the right thing, right?
Yeah. No. I think that education, obviously patient education, is always a good kind of standpoint of how to kind of correct that. definitely hard because, I wasn't like I went to PT first and then I went to go see an ortho, right? I think usually people do the opposite. They go see the ortho first and then see the PT after. So it's kind of tough to see that conservative side of things before you get into that more drastic side of like surgery. But it kind of does maybe a little bit of your own kind of research, I think, as well too. Again, I was happy that my parents worked in the field and I was able to get a second opinion. To be honest, man, I probably would have done what you did if I didn't have parents that had worked in healthcare. I probably would have gotten surgery because I wanted to keep playing. And this is like one of the most brilliant minds. These orthos are super smart, and I would have done it for sure. But for me, I was always like kind of like keep surgery as kind of last option. Probably why I'm so happy about the PT field. But just for me personally, I knew that I'm a guy that likes options sometimes as well too, and just having that kind of like ability to go to someone else and maybe see what they thought was super helpful. And I think it helped too that I wasn't really like a crazy grade 3 kind of tear where it was something bad. It was something on the cusp. So it wasn't anything that was like, you have to get the surgery right away.
Yeah.
It was more or less just, see how bad it would get in the long term and then make a decision from there. So like I said, I'm happy that I was able to, have those options. I know a lot of people don't really have those options. So I think the cards would just kind of align that way. But just for future reference, I think, that was about 10, 13 years ago now. So the temperature of like how plan of cares might be a little bit different than it was back then because now it's pushed for more PTs. The doctorates isn't more of like a common thing. So people are coming to us now before they go to the orthos. And I think that shift in that kind of mentality is also big with how maybe we can help with having patients make their own decision as opposed to just relying on orthos. Not there's anything wrong with, getting any opinion on orthos. They're super smart and they probably want what's best for you. But at the same time, it's your body, it's your health. And I think you should be equipped with the most information you have before you make a decision, obviously with ortho and, physical therapist influence. But ultimately, you're the one that's going to, decide if you want to go under the knife or not.
Yeah. Totally. That's totally true. It's have you had any success stories that you could share? Like, what's one person in your mind right now where they were scheduled for surgery or were really gun-ho about it and then coming to PT they changed? Yeah,
sure. I think there was one patient that I had. He's a little bit older, and he was a skier. He kind of tore his ACL skiing. And when I mean older, I mean like probably not a candidate anymore for surgery, right? And he wanted to, get the surgery just because he was an avid skier. He's a little bit older, but the guy looks like he's like 40 or 50. Like he's in ridiculous shape, super active dude. And saw like an opinion saying, he's like on the cusp for getting surgery, kind of similar situation I was when I was younger, and he wanted to do it. But thank God that doctor also wanted to do a little bit of prehab before getting the surgery. As we go through the prehab, he's starting to get stronger. He's starting to look like less unstable. His knee looks fantastic. And when we get to that point where, around like making a decision about surgery time, he was able to avoid surgery. He went back to skiing. He was a little anxious, but besides the anxiety, his knee was ready. And yeah, we were working for a good 6 to 8 months. But after those 6 to 8 months, I mean, he looked fantastic. So, it's a great story for him to kind of get through that.
That's really cool. And that probably makes you feel good, too, as a practitioner to see that.
Of course, yeah, of course.
When people come in with this, solid line to this is what I got to do to get better, and then we're like, you can have this alternative route and still be good, and they're successful, which is, really puts light to our profession and what we do. So that's why I always like to bring stories into it because, for us, we've been doing this years now, so we have those stories.
Of course, yeah.
You see a new grad or someone who hasn't really done it, they the buy-in might not necessarily be there yet because they haven't had that experience, so it's good for people to hear that. And it's good for anyone listening, if who knows who's listening right now to be like, oh, wow, I didn't know that was even an option. So it's always good to bring light to that.
Of course.
Cool. So that's a little background about Jade. We can go into a story too, which is nice on Iron Health and how you kind of came full circle to here and your current position as of now. It'd be nice for people to get to know you on that level. Yeah, sure.
So I've been a PT for about 5 years now, which is kind of interesting because it went pretty quickly.
It's
just like that. So I remember I met you when you were still starting Iron Health. It was 2018 around that time. You've established, but you were trying to grow it and scale it a little bit up. And I had been working at another place full time, and then started working for you part time. And like I said, just seeing kind of the stuff that you were doing was just like next level, right? And it's great because it gets into our topic of what we're talking about, which is systems in place for, not just small businesses, but also just businesses in general, and how it helps make things on the operation side a little more efficient and makes your job as a clinician a little bit easier. But just kind of seeing that really drew me to like, how you ran things and how I think things should be ran, to be honest, because it makes everyone's lives easier. And ultimately, which is the most important thing, is that it makes patients better, they make them faster, and you build a rapport with them. So not only are you their physical therapist, but you're kind of like just their advocate of how they should, live their life in the most healthy way in terms of movement or whatever the situation is and what their goals are. But going back to how it was before, I remember that, when I first started over here part-time, I really believed in, the vision that you had for this company. And again, like I remember, and I tell this story a lot to you, where, I'm working full-time in one place, I take a nap in my car for like 15 minutes. I come back over here and I start working a little bit. So, once I was able to, fulfill what I need to fill at my other job, I was like, you know what, I really want to, come on board with Iron Health just because of, again, like the culture here was fantastic. The one-on-one physical therapy is just unmatched. I think that should be the way that healthcare does anything, not just in physical therapy, just in general. People need that one-on-one. They need that individual kind of planning for their plan of care, because I think that's how people get better. And it kind of shows with some of the stuff that we do here. So I was super happy, once I kind of came on board here, and I try to learn as much as I can clinically and just like, professionally, developmentally as well too, just so I can be the best PT I can be. And I've been, trying to work my ass off here, and I was eventually, and I'm super thankful for you as well too, to get promoted to be a clinical director here in Ardsley. So came kind of full circle for me, just being part-time here all the way to my experience now, my journey to helping to run this Ardsley clinic. So very blessed to see how that kind of transitioned, and very happy to make that decision back in the day, and very happy to have you guys kind of coach me up, mentor me, and make sure that we're on the right track to the same goals.
That's awesome. And it's amazing. Ardsley, like Jade said, he's the director here. He runs this place with a tight ship and make sure everyone gets what they need. And I'm appreciative of that. So overall, like just both sides of it, for sure.
Thank you.
But segueing that, that is a good segue into us discussing systems, right? And the reason for us talking about systems is it's a couple of reasons, right? Like, I know when we were deciding to do this podcast, it was like, hey, what do you want to do? What drove you to say, hey, we should talk systems?
Okay. I had a couple ideas for these podcasts. I actually want to do back pain because I also suffer from back pain, suffer from a lot of pain. But I ultimately want to do systems just because I feel like it's just, like I said before, it's such an important part of how businesses are ran. And it's pretty overlooked, I think, especially in that private practice kind of setting that we work in, whether it's orthopedics, neuro, or even like a doctor's office. I think not having those things in place really sets you up for failure, and having those things set you up for success. And I think that if more businesses kind of hear how things are ran, not necessarily how things are ran, but putting the right things in place, it'll make everyone just happier. The culture gets better. People get better, which is like the ultimate goal of obviously what Iron Health and just what healthcare should be. And I just believe that it is how things are ran and how they are kind of processed. Of course, things are adaptable, but these things help drive businesses. And whatever the business's goals and values, and obviously we have great values that are very patient-centered, and help with us to develop clinically, but it drives those values in a way where you can actually achieve them and not just say it, put it on your website, and it's just there hanging. You know what I mean? Like these systems within these operations help you achieve those goals through just a blueprint of processes. And I think that a lot of small businesses really lack some of these systems. And I remember when we first started kind of talking, back then, you told me to read this book called The E-Myth, and it kind of changed my perspective on all that stuff. And if some of the listeners haven't read that book and they want to be potential business owners, like definitely go ahead and give that a read, because after reading that, I really got what you were talking about in terms of how you ran your business and how you wanted it to go, and giving even the future kind of like insight that you have and where you want to take it. Those things wouldn't be possible with those proper systems in place, having the people to run those systems. And I think that's just a very overlooked part of healthcare, and I think that some people just need to really address it and find a way to make these things work, because it's such a big difference in some of the places that I've been through in the past, and what I'm working with right now.
Yeah. So why are you so passionate about it? Like, what drives you? Do you like the aspect of having the check the checklist.
Yeah.
Do you like the aspect of running efficiently? You know, for me, because I know like what drives me is obviously that book you mentioned, and really in reality, this is fun for me. So it's like the way you scale is through systems. Well, obviously, we'll dive into that a little bit more.
Yeah.
But what drives you to systems management?
I think originally and I still feel this way too, systems has helped us maintain a one-on-one model, which I think is like the number one kind of thing that sets us apart from most other physical therapy clinics. Not just from, what we do internally, but also looking at patients, look how happy they are. Not even just when they get better. When they come in, they feel like, we say that we give that living room experience. That's all part because of how we put things on the back end to make it feel that way, right? So that's just really super important. And I think that, with all these systems that we do kind of have, it just drives like all the goals, like I said before, like all the values. But you also see too the culture that we have here. PT, there's a big burnout rate with a lot of the professionals that work in this field, especially on kind of the younger end, right? And having the systems to develop this culture that you have of just like that living room experience, not only do the patients respond well to it, the PTs respond well to it too. I think that drives a lot of ownership, a lot of hard work, and a lot of just dedication to their craft, but also how they help grow this clinic. And I just believe that whatever we have in place for the system to drive that kind of culture is really combating what this burnout is kind of happening in the profession itself. So not just from the patient perspective, also from like the physical therapist perspective, that helps a ton because they're not seeing 4 to 5 people an hour. They're seeing one-on-one, and they're not trying to cram 30 notes, in on Sunday night. They can kind of do it while they're here, but at the same time still, pay attention to the, to the patients that they have because it's still that one-on-one. And again, our systems allows for that, for us to do this. When we look at some other places, not to name any kind of big corporations, but you might know the ones I'm talking about, where their systems are good for sure, but may not be tailored to some of the things and some of the goals that they might have. And, I have a, deep respect for a lot of those things that you have in place because, people are happy and patients are happy. And that's kind of hard to find in, especially in this kind of setting. So that's kind of why I kind of fell in love with it. Again, not just from the patient aspect getting better, but just the employees look happy. And I think if the employees are happy and patients are better, it's a home run.
Yeah, absolutely. I totally agree with that. What are some things that you've seen at other places that you're like, well, that's a system that doesn't work? Or, what are some things that you see here that we run on that's a very good system, and we can dive into the specific examples if we want to, or not. But I think it's good for us to look at experiences in the past that you saw, like, hey, the system is not efficient. That I don't.
Yeah, sure, I agree. I think just like the way we run kind of how we communicate with each other is a system on its own, right? You have a system or a communication just for billing or just for like, scheduling. And other places kind of don't. It's kind of like a free-for-all where it's kind of like, someone at the front desk, they talk to me about billing. And then I'm like, well, it's not really my specialty. I'll do what I can. And this was me as a new grad. I'm just trying to survive, right? Yeah. I'm just trying to kind of learn some things. And I didn't really have like someone that I knew that I had to talk to for that billing aspect. That's someone that we have here where, like, okay, we have a triage of like, if a patient has a billing question, talk to X person, and then they can help you with that. So just having that system for just, who to go to for different problems is already a big kind of thing to begin with. And in other places that I've seen, not just worked at, but also just seen in general, I shadowed there, or, I'm doing hours for some kind of requirement for school. Like, they didn't have that. It was just kind of like the front desk would come back and we'll kind of talk about it. And then I wouldn't know where to go, or whatever PT I was shouting wouldn't know where to go after that because that wasn't really their forte. Yeah. So I think that just scheduling and insurance and billing alone is a big deal. And if you think about it, with any kind of business, like getting people and through the door, that's what keeps you alive. So it's just like that thing has to be on point if you want to not even alone succeed, but also just to stay put the lights on. That needs to be on point. So, when I saw that alone, just from the first day that I worked with you when I was part time, like that was already such a game changer. And I wish that a lot of other places done that too, because so much potential could have been met. But something as simple as just putting a chat for who to kind of talk to about certain situations, like that's so simple. But at the end of the day, like some of them weren't implemented, and it really hindered a lot of their potential. And obviously here you see the potential being hit.
Yeah. What do you think it is in the individual that causes that? So some of these other places you've been at versus here, why do you think people can't see that big picture?
I think there's a couple things. I think traditionally especially like PTs, doctors, whatever, we're not really trained in that way, right? At least for my program, what happens is, they train you to pass the boards. Maybe there's one business class, and it's kind of like not a great class. Not knocking my program or anything like that. Yeah. But, I get it. There's a lot of things that need to be taught within the span of 3 years. We just upgraded to the doctorate program. So, business is not really, or business development is not really, a big focus when you're in school. It's more or less they want you to pass the boards, they want you to graduate, and then you're off to the races. Like, you're off to start your career. So I don't think, in the initial training, there's not enough, of a training. There's not enough of education on that kind of front. I mean, I'm sure yourself, you do a lot of things, individually on your end where, you're attending conferences or you're reading like a ton of books, and, that has helped you develop, the stuff that you've kind of implemented today. And I think that just from the back end, in terms of just education-wise, it's just not there. So that already puts you at a hindrance for kind of success if you want to go into that like business kind of route where you do want to open a clinic or you want to work in that kind of like that kind of space. Yeah. So I think that alone is kind of tough. I think number two is that we get kind of in our own heads a little bit as these doctorates, doctorate of physical therapy, medical doctor, doctor chiropractor, whatever it is. I sometimes feel that, we think we know all the answers, right? And, we have to be humble enough to be like, hey, I don't know business. I don't know, like, what I'm doing. And sometimes when we have that doctorate degree, we hold ourselves to a higher standard, even if it's not healthcare. And I think that just humbling ourselves just a little bit to learn some of that stuff can be a tough thing to do, just because, you put all this time into school, and now let's say you own this clinic and you kind of run things a certain way. It's hard to change, the way you fit. Mindset's one of the hardest things to change. And I think, getting into that focus of being able to be like, all right, let me take a step back. Maybe what I'm doing right now in this business isn't working. I don't know why my patients are dropping off. I don't know why they're getting better. Being able to humbly be like, okay, maybe I'm doing something wrong. Let's take a step back. Let's rearrange some things. It's hard to do, especially when things are kind of running at a level where you're kind of like complacent of what's going on.
Comfortable.
Exactly. Yeah. And when you're comfortable, sometimes you just don't want to change things, and maybe you like it the way they are, and it's hard to change it like that. And whoever comes in and out is whoever comes in and out, because what you have here at the end of the day might be working for you, but maybe in the long run it might not work. So I think it's kind of two things. Like I said, it's the education, and also maybe some of the complacency, and you just need the drive to kind of learn more. I think that's the biggest thing.
Yeah, that's an interesting one, because that goes back to the EMIT too, when they talk about the technician, like being a technician versus actually have an overlooking view of what's actually happening. The complacency thing, we can have a whole podcast on that, like mediocrity and complacency, and how to grow as a person. And I think one of our values is grow together, and I put that one really high because I want to grow as individuals here more than anything else, right?
Yeah, for sure.
But systems management too. Let's take it from a PT perspective. Like, why is systems important for them to be?
So I think, systems help, with PTs, especially new grads in general, just thinking about, let's say, an initial evaluation, just going through what needs to be done, whether it's, pretty in-depth history, you go through, some of the ranges of motion, active, passive. That's a whole process. That's a system right there. And, it takes years to refine it. Like myself, when I first started, my systems were all over the place. Like, I was doing active, passive. I was, checking reflexes. I was also, doing special tests. There's not really too much of a certain outline of how I did things. And obviously, with experience and with time, that gets more refined and it gets a little bit better to where a point where, you're doing maybe a pretty good eval, not quick, but efficient. That's what I'm looking for. And, sometimes as PTs, you need that kind of system, even on a clinical level. So you want to look at certain things when, let's say, a certain diagnosis comes in, when maybe something like an instability. You want to look at what does their muscle tone look like, what does their strength look like, and stuff like that. Could be totally different than someone that's super stiff, and maybe you would look at the opposite. Maybe look at some range of motion and flexibility. So having these kind of systems in place clinically is going to be important for the PT, just to determine what their plan of care is and how ultimately they're going to treat the patient. And now you also have things, let's say, in examples like that, Ottawa ankle rules, where there are systems in place to be like, okay, should this person go get an X-ray because they can't walk, or they have this kind of issue. So they're everywhere actually clinically. It's just that we memorize them and we think of them in such a scientific way. But you think about how they're developed, it's made through, research and processes and looking at things where, patients respond well to X treatment. And, they're literally how we make clinical decisions and clinical judgment. So just in terms of like reading a research paper, you can see the systems that they put in of how they ran, some of their, hypothesis, how they tested it, all the the T-scores and everything that needed to be done to prove some kind of statistical significance. Those are all processes and those are all systems, right? And that drives what we want to do going forward. So they're all over what PTs want to do. And in such a micro scale, let's say with just treating patients, you'll have a system of, let's say, load them, progress them, and then if they look a little bit better, then you move on to the next phase. If they don't look good, you keep them there or you regress them. So it's all processes, all systems, right?
Yeah, it's true.
Yeah.
Yeah, I think for PTs too, it's an important. It's so important for treatment. It's so important for quality of life. Like I would say here we try to have a good balance, right? Like of making sure you can live your life and not really just be bombarded through work. But that's a system too.
Of course.
Like how do you manage making sure you're doing your notes, make sure you're doing your research, like staying on top of that stuff. So systems are and I like the way you put it, like they're what creates like the bottom, like what everything's coming forward,
Right.
and then how we move forward is through system management. What was like the first big system that you implemented into your treatment style that works for you?
Ooh, that's a good one.
Yeah.
The first big treatment system into the treatment style, I would probably have to say, probably with my shoulder evals. Just kind of, I learned this from my last job. The guy was a wizard, doing shoulders as well too. And I think just because of my background, like I kind of interested in shoulders. Yeah. But just kind of how I try to group a couple of movements into just like active. When I'm doing active, let's say into like just the scaption plate, I'm already testing a couple of things in the rotator cuff. I can move them in certain ways where I'm doing some passive range of motion. So just making that more efficient. So I'm not that I'm spending less time with them, but like I said before, I'm testing multiple things at once, so I don't feel like I'm wasting too much time. But at the same time, I'm looking at everything that needs to be done because the patient deserves, that level of, I guess, interest, that level of that one-on-one care. So, but being able to do that where I'm looking at multiple things at once, I think that's really been a kind of game changer for me. Not just from a time standpoint, but I think just also it makes me look at how the shoulder moves as a whole. And when I kind of saw that, really drove a lot of my patient care and a lot of my interventions. And I think it was a really big deal for me. And I was maybe like a year or two out. So it takes me a while to develop these systems clinically.
Yeah.
Just because anyone that's a new grad too, you're learning a lot. And it's not just, the clinical stuff. It's also the professional development. It's also just learning like the tricks of the trade. So, I know a lot of the new grads that we have here, they get maybe not frustrated, but sometimes they're feeling like, I don't really have a process of how to do these IEs. I learned them a certain way in school, but when I go out there in the field, it's totally different, right? So I think just having, some kind of like a backbone or a background of how to do some of these initial evaluations is going to be beneficial to them to kind of do things. And I think too, we also set up another system for mentorship where, they also shadow us before, they see a full caseload because they, we need to make sure that they're good, but also we also make sure that, they feel comfortable doing these things. So even just a system of mentorship, showing the stuff that I learned from another person to a new hire is huge too, because then they kind of continue that continuum of care of that high quality. So I think all of that is very important in terms of just teaching that next kind of generation and those new PTs of how to do things, because there's a system for a system. It's kind of what I just explained, right?
Yeah, totally. That's so true.
Yeah.
I like for me personally, treatment-wise, the big game changer was the selective functional movement assessment.
Oh, that's what I meant.
That's like my go-to for everyone, just to see their movement quality, and it's in reality it's super standard. That's what it comes down to, a system, right? Like system and SOAPs. You ever hear of SOAPs?
Yeah.
Standard operating procedure. They go hand in hand, and for us to evolve, we need to make sure that our systems are on point, but the systems are then broken down to these SOAPs.
Yeah.
So then we can make sure, like, hey, this is the exact avenue we're going to keep developing this program or this process.
Yeah.
So it's important to have that structure in mind, when we do anything.
Oh yeah, for sure. And I think too, especially like on that clinical side when we're treating patients, your systems are always going to adapt and they're always going to change, right? You can't have anything like always stagnant all the time, because that's not how you kind of grow. You have to evolutionize, the things that you do. And again, I think having that adaptability to some of your systems is what, have some, not just therapists and doctors, whatever, even businesses too, need to be able to be adapting to the times, because I'm sure things you did, before pandemic is way different than things you do now during the pandemic. Same thing too with just, patient care. I'm sure the research 10 years ago is not the same as the research now. They have to change a couple things, right?
Very true.
Yeah.
Let's go into scale now. So the importance of systems and scalability. So I guess this can be a open discussion on, like, where do you think, like, obviously we're growing, Iron Health's growing, you're starting to lead Ardsley, doing a great job at that, and we're going to keep growing up. What are some things that you think we're gonna need to start systemizing more as we grow, and what are the necessities as you grow? What do you need to? What systems are needed?
Oh man, that's good. That's a good
loaded
question. That's a loaded question.
Yeah.
I think I said, like, when my last point was just, in order to scale, things need to kind of adapt and change, right? So that's kind of the thing I think that needs to be kind of the paramount at the most. Probably, I would say maybe communication will probably be the biggest thing. I know that's a pretty general, like, broad spectrum of like a topic, but communications maybe within different parts of the business, like let's say billing, or or implementing some kind of new, like product that we're kind of roll out, or any kind of new service. As we get bigger, there's going to be some kind of misconstrued information maybe along the way, on the way down, just because we're getting bigger. There's more heads here, there's more mouths to feed, so there's a lot more, I don't want to say at stake, but there's also a lot of different lines where miscommunication can happen. So I think that's kind of where a lot of the changes, or kind of the scaling, should kind of take place a little bit too, is a lot of communication. And again, it's a lot of just making sure that these systems can change in a way, but you still have those values, at the forefront, right? Whatever can change, anything can change, essentially. Mm-hmm. Like, as we get bigger, we expect to change. But I think what has to be the most important thing is that we're changing in a way that's still leading towards those values. And who knows, those values can change too as things grow. But then you have to have a different conversation, about that. But just in terms of just scalability, I think the values that we have here are amazing. We have those values, we hang it up on the wall there because we believe in those. And you want to make those values still the most important thing of the company, while still growing it, because I think as a lot of companies scale, they maybe lose some of their values, or they change, which is fine. Values can change as well too. But if we strongly believe in some of those values, then we have to make sure these systems are able to adapt so that we can keep those values, but the business still grows. And that's a tough thing to do. Yeah.
But it's the fun stuff too. At this point, where we have a pretty awesome team. I would say we're stacked, and everyone. We're a young company still. We're 5 years in. So like where we are now is like, and the people we have on board now, we can exponentially grow because we have the people who are in. They want to grow, like yourself and everyone else. It's like, hey, let's do this, and like let's figure out a way. And it's just an open conversation, which is really cool. I think that's the important part for scaling too, and making sure communication obviously is so important. Like you're saying, you need to communicate on all walks, on all avenues, and be honest about everything too, because that's a value of ours. Honest communication is one of our values. So it's so true to keep scaling with that. But it's the fun part. Scaling's fun. It's like we were talking about before, complacency, right? Like if you're going to scale, you can't be complacent, because you're going to start. You have to compete at a higher level. You have to start performing at a higher level, and you're gonna. Every level, there's a new devil, as they say. So like the bigger we grow, the more things we're gonna be like, where did that come from? How do we deal with that? Mm-hmm. What's happening here? So it's all fun. It's all fun.
It's very fun.
Yeah.
I think with scaling as well too, and obviously with systems, I felt it the most this past couple of weeks. I went on vacation about a couple weeks ago to Texas. It was super hot.
Yeah.
But when I came back, everything was still standing, right? The clinic wasn't burnt down. No, they did a good job of, someone taking the lead and kind of running what I was doing before. And I think that's a good testament of how good the systems are here, because you can literally just leave for like a week. And I know you had your wedding a couple months ago, like was it November, December? Yeah. And you left for a amount of time, and things were still going great. And I think that's not a testament to how good the systems are, but also the scalability, because, someone like, yourself, who's pretty much running the company, and just leave, and like it's still standing and it's doing well.
Yeah.
Like that's pretty good in terms of like how you implemented them, and just with scalability, because if you think about it, there's more people in the company. You have to communicate all the information that you need to get done to them, because you're physically not going to be here. So having that ability to just walk away for a little bit, and then just have the rest of the company just pick up everything and take the reins of it, shows growth, and it shows adaptability of the systems, and shows that they work. So I think the scalability, you've seen already, because you grew from just one table in like a gym to like a 3, potentially 4 or 5 clinic kind of practice now. The scalability is there, and the systems are working. So I think you've already seen some of that with the systems and scalability.
It's awesome, and we're at the point now where we're teetering on more growth, which is like. You know, and I think we have a great leadership team that we're ready for it. You know,
For sure.
100%.
For sure.
So I mean, we could segue that into the future of IH, you know, and like where obviously from my standpoint, where we're taking it, we're definitely opening more clinics, right? So
Nice.
at that point, we'll have a centralized kind of management group who helps lead and systemize everything, which you and I spoke about, and that's important for scalability too, because it's like who are the people who are really the decision makers and driving the ship in essence, and that's going to be a core group that's like, hey, this is where we're going, this is where we need to go, this is what needs to get done, so it can kind of go along with the whole process, you know.
Yeah. For sure. I'm definitely excited to see what the future holds for sure.
Yeah.
I think that, you're definitely going to scale it to, more clinics as well too. But I'm excited to see what the system's going to look like, man, because, your system now might be different from what it is in the next 1 or 2 years when you have more clinics. But it could be a good problem to have as well, you know?
Yeah, totally. As long as we have the right people here and, and I know you're along for it, so let's make it happen.
That's right, man.
All right, any parting thoughts, any closing statements? We got to wrap this up with?
Yeah, sure. I would say, just congrats to the new class of PTs that are coming out right now. And, keep grinding, guys, just because, PT is definitely tough work. It's super rewarding, but also don't knock the other side of it. It's not just the clinical stuff. It's also how do things run, because how things run is also going to dictate how you're going to treat and also, how you kind of run through your career. So just keep that in mind, too. And look out for the professional mentorship. I know it seems kind of easy to do, but it's kind of tough to reach out to people. It could be a little intimidating. So, for all those kind of new grads out there that just graduated and they're starting their career, and, good luck on your boards, by the way, in July. But just, reach out to some people. If you kind of put a hand out there and be vulnerable and transparent, you're more than likely that someone's going to reach back and kind of help you out and show you the ropes and maybe get you to greatness as well, too. So that's kind of my kind of parting words to anyone that just kind of came into the field.
I love that.
Yeah.
Get you the greatness.
Thank you, bro.
Awesome. Thanks, Jade.
All right, man. Of course. It was fun.
Powered by Iron Health. I can say it.
Power by Iron Health.
Powered by Iron Health.
That was fun. That was